Mr Speaker, my question is to the Minister for Health and Wellbeing. Can the Minister update my community as to the current situation of the number of vacant rooms in Hammill House, which is the aged care section of the Port Pirie Regional Health Service? And with your leave, sir, on that House, I'll explain further.
Leave is sought. Is leave granted?
Thank you, sir. I have been advised that with the recent vacating of the Allied Health building, which had to be vacated some time ago due to the pigeon infantation there, my information is that they have utilised the whole of the western wing and also one room of the aged care facility, which is in the Hammill House section. I am also advised that there are currently 7 vacant rooms where residents looking to go into aged care cannot be utilised or housed, or is the Allied Health going to utilise the whole of the spare rooms in the aged care facility of Hammill House?
The Minister for Health.
Thank you very much, and I thank the member for Stewart for his question and note his very significant interest in services in Port Pirie, and particularly in terms of also Hammill House as well. And as I think last sitting week we talked about, we have had to temporarily relocate a number of those allied health staff from their office accommodation in the previous community health building into other accommodation either on the site or off-site while we're undertaking the engineering and other types of assessments in terms of the work that we need to do to get that old community health building up to scratch to return to office use. As the member has outlined, in Hammill House there has been some capacity, and so we have utilised temporarily some of those areas in Hammill House for that work to occur. In terms of Hammill House more generally though, as the member knows, and he has been a very staunch advocate for, there was a period of time in which the board were considering the future of Hammill House and whether or not to keep Hammill House into the future. I was very, based on the advice from the member Stewart, insistent that the board go out to the community and consult, and the feedback from the community was overwhelming in terms of the desire for Hammill House to continue. And so that decision has now been made for Hammill House to continue, and the local health board, the York and Northern Local Health Network, is going through a process of recruitment of additional staff to enable the capacity to increase. And in the meantime, if there is demand on those beds, then of course there would be a waiting list. But the good news is that I'm advised is that we currently don't have anybody on a waiting list to go into Hammill House, and we do continue to recruit. I understand there was an assistant nurse lead that was hired in April, and I'll certainly keep the pressure on the York and Northern Local Health Network in terms of their future recruitment, because we do want to see the number of residents utilising Hammill House to increase, at the same time that we are working through the longer term arrangements in terms of those community health staff for their office accommodation.
Member for